In this presentation in our series, A Roadmap for Healthcare Publishing, we're going to look at what's unique about healthcare research. Well, it should be immediately obvious to you as a healthcare medical science researcher. People in this particular subject area are often extremely busy. They have competing time demands, and as you'll know, of course, the literature is very large and very dynamic. So these three issues initially mean that healthcare research is unique as a particular academic endeavor, as a particular kind of academic research that we want to write up and get published in leading international journals. Let's ask ourselves, what does this number mean to you? 861,000. Do you have any idea what this number is? What does this number mean in the context of healthcare research? This number is the number of medical science articles that were published in SCI journals in 2019, last year. So Science Citation Index journals in 2019. That's more than 2,000 articles published each day in medical sciences across the world in the more than 30,000 academic journals that publish this kind of research. 861,000 published in 2019. You need to stand out. How can you make sure that your research gets read? How can you make sure that other people are going to notice your research as a healthcare professional? Very important to think about this because, of course, you want people to read and cite and use your research, your next academic article. So articles, of course, in healthcare research need to be accessible, and this is more so the case than other academic endeavors, because not just other researchers in your own subject area are going to be reading your papers. Clinicians, people who use your research, will also be interested in learning the outcomes of your studies, and stakeholders, perhaps government officials, perhaps people interested in healthcare policy, will also be reading and using your research. And of course, the general public as well. There is no other field of science, academic endeavor that is of such general interest to the public. So it's a different kind of writing, it's a different kind of publishing. Articles in healthcare subject areas, in medical research, they need to be more accessible than articles published in other fields of science. There's also a large number of different kinds of healthcare articles that are published by researchers, more than other academic disciplines. And this in part goes some way to explaining the sheer numbers of papers published every year in this academic discipline. Research papers and reports, standard academic peer-reviewed literature, as well as clinical reports, case studies about particular diseases or particular interventions, as well as drug discovery reports, maybe published by researchers, published by pharmaceutical companies, published by individual research groups, as well as trials and interventions. So, in healthcare publishing, as you'll learn about in this training course, there are also very clear and distinct ethical issues that researchers need to be aware of and that you need to comply with if you want your research to be published in a leading international peer-reviewed journal. Different kinds of articles and clear and distinct ethical issues to deal with and learn about. Getting started with writing is important, and it's necessary to think about what your title will be of your next article. It needs in medical writing to be short and capture people's attention, less than 20 words. And you need to put keywords into your title so that search engines will optimize the discoverability of your next article. Databases like Mesh and ethical guideline search algorithms will be able to find your work. So doctors, medical researchers, members of the public, stakeholders will be able to find and read your work easily and efficiently. So when you are thinking about your title as a healthcare researcher, you go through a different series of steps to an academic working in another research field. Who are your audience? Very important to think about the fact that your audience as a healthcare medical researcher is much broader than the audiences seen in other academic fields. So titles are critically important. Think about how busy most of your audience are going to be and how general the title has to be to engage with all of the potential stakeholders. The same is true of your abstract. When you put together that summary, that 200-word summary of your next article, you will make a number of decisions in the writing process to make it accessible. Why did you do the work? What did you do? What did you find? And what did you conclude? In that sequence, so that readers will be able to follow and engage easily with your study. And of course, often the abstract and the title is all that people are going to read of your healthcare publication because they may not have the time to read any more. So you have to accurately reflect the full text of your article. Your busy audience, your busy stakeholder audience may only read this. So being effective in your writing is another key skill. This training course will help you with some of these key skills, but it's quite different in healthcare medical writing than in other academic disciplines. Checklists for research, for being effective and making sure that your research meets all of the necessary ethical guidelines include checklists like the PICO checklist. Who does your work relate to? Who are the patients? Who are the population? Which treatments are you using? What interventions do you have? What comparisons? What's the control? And what's the outcome of your study? Thinking through these kinds of checklists before you start to write will help you as a healthcare researcher be as effective as possible. And we need to sell our work ethically. We need to make sure that the message that we are getting across with our research papers in healthcare and medical science is effective and ethical. Your research outcomes must be communicated honestly. And in this training course, we're going to give you some help with doing that, assembling your message into 1 or 2 sentences to get it across to your audience in a clear, easy to understand and ethical way so that nobody is confused, everybody knows what the outcomes are, and people who need to use your work in future research or as stakeholders or as government policymakers or as members of the public have no confusion about what your message is. This is important in health and medical sciences in particular, being ethical as you get across your results and you tell people the story of your research. In terms of your career as well, messaging is critically important. Retractions and mistakes in healthcare research are actually quite common, as you can see here, and as we are experiencing at the moment in the context of what's happening around the world with the COVID-19 pandemic. Retractions happen, but you as a researcher need to gain the skills in writing and putting your work together for submission to journals so that you don't end up having to take one of these career-affecting retractions with your own writing and publishing. So, in this presentation, we've talked about the uniqueness of healthcare research. We've talked what's unique about healthcare research. In particular, writers are extremely busy. Researchers are extremely busy. There are competing time demands, and there is a very large and dynamic literature. So how you can get on top of all of this, one of the goals of our training course. Thank you for listening.